I am Dr. Vijaya Baskar, Masters in Orthopedics, Professor in a medical college, and I am a Chairman for Ethics Committee, Clinical Research and Trials. Bone marrow. The bone marrow is the major content in the bone, where you can see this is the cortex of the bone, and the marrow is interlocked bony fibers in the bone. For example, the outer is the cortex and the inner is the bone marrow. So the cortex is maintains the strength along with the trabecular pattern or the bony fibers in the cavity, in the canal. So this is most important to maintain the quality of osteoblastic activity, osteoclastic activity. So there will be naturally sometime the bone cells will retain and then they naturally die. That called bone osteoclast, where the new bone formation is called osteoblast. So through the osteoblastic activity, regularly there is a degeneration and regeneration of the cells which maintains the bone marrow. So bone marrow is the most important for all the children and adults, where children will lead to, if the marrow the proper vitamin D and calcium is not there, then there is a possibility of vitamin D deficiency and calcium leads to osteoporosis. That means the bone becomes brittle and smooth and softy. So obviously there is that time then it will lead to fractures or any other diseases like osteoporosis, osteomalacia or chondromalacia. So when we know that such marrow which should maintain its quality, quantity, so that the shouldn't sustain any simple injuries lead to major fractures, and then there is a possibility that there's a degeneration in the bone will increases, and then there is a development of deformities in the joints where there is a wear and tear is there. So obviously when the degenerative disease causes the wear and tear in the joints, leads to deformity which she or he cannot walk or stand. So like that, the bone marrow is the most important, where the bone marrow cells will be maintained. Certain times bone marrow cancers are there in certain ages, so that the bone marrow cancers should be recognized, and bone marrow infections like osteomalacia, chronic osteomyelitis and acute osteomyelitis due to infection of the marrow. So these are the conditions where certain diseases, congenital diseases also develop in the bone marrow. So these we must remember to take care of it, so that the bone marrow problems will not develop. And obviously we should take a proper diet regularly, so that the bone marrow quality should be maintained.